Hi, I'm DiMatteo of the Ask the Pharmacist radio broadcast. Thanks for tuning in with me today. Today our topic, joint relief. How do you spell joint relief? We talked about in previous videos, how do you spell heartburn relief, acid reflux, that whole scenario. Today we're going to talk about how do you spell joint relief. A lot of different components in the traditional medical community, pharmacology-wise. We see joint relief as more and more non-steroidal anti-inflammatory drugs. I believe that creates a significant problem. First of all, we know that non-steroidal anti-inflammatory pharmaceuticals used to treat joint discomfort, joint breakdown, joint inflammation, osteoarthritis. Osteoarthritis implying a wear and tear mechanism. Now, when you use non-steroidal anti-inflammatory drugs, what you're doing is you're reducing inflammation and you will reduce pain. I would not argue that. But the mechanism through which that is done is a reduction in what's called glycosaminoglycan synthesis, or synthesis of eventually proteoglycans. You have to make glycosaminoglycans first, convert to proteoglycans, then to collagen. That has all to do with the joint, the structure of the joint. Now, there can be a lot of factors that go into why that joint breaks down, joint destruction, but let's just focus on the use of pharmaceuticals. Not only do they increase the incidence of cardiovascular issues because it blocks also other repair mechanisms, prostaglandin synthesis, but it also blocks proteoglycan synthesis in the joints. So actually you get short-term gain, long-term pain. In other words, the non-steroidal anti-inflammatories will actually give you short-term pain relief, reduce the inflammatory process, but they interfere with the body's normal repair and manufacture process. So see the joint as a dynamic system, a living system. It is a type of a spongy network. Now everything from the hyaluronate, the production of the synovial fluid, to the cartilaginous structure. These are spongy, literally living tissue that have to be replenished, hydrated by moisture. Inflammation breaks them down, which I'll get to in a minute. So if I interfere with that process of synthesis, I actually inhibit long-term repair mechanisms for that joint space. Well, how do I get there in the first place? Well, first of all, long-term trauma, athletic events, overuse of the joints, folks with whether they're plasters or cement finishers, or someone that was an athlete that was involved in athletics that took a tremendous amount of destructive types of blows to the joint. There are a lot of issues and factors that enter in. Those are some of them that will encourage breakdown. Some folks have had knee damage, as an example. That leads to an increase in inflammatory process, which over the long term causes a further breakdown. Diet, a poor diet. A diet that is very high in sugar, saturated animal fats, refined products, and not enough natural antioxidants and core nutrients, trace minerals, manganese, copper, etc., are all involved in glycosaminoglycan synthesis, GAGs. I would refer to them as GAGs. So micronutrients and poor macronutrients. I eat poorly. I have either been involved in an occupation, work, whatever, that encourages a lot of joint destruction, or maybe I just don't repair well, and at a joint space level, I do not repair well. What are your options? Certainly you have pharmaceuticals. They provide short-term options, and maybe sometimes for a period of a couple of weeks to get the inflammatory process under control. That is not a bad thing. What are you doing long-term? First of all, I believe that you have to be proactive in your 30s and 40s. I've been using joint support preps for years. Quality forms of glucosamine and quality forms of chondroitin, which we'll get to in a minute, what constitutes quality. You have to be in a proactive state that you're building these joint spaces. The other portion of this is that as that joint space is broken down, many times the level of discomfort that you feel is not noticeable until there's significant loss of joint space. In many cases, there's such significant loss, it's almost irretrievable. You can't get it back. So I tell a lot of folks that in their 30s and 40s, they need to be thinking about supplementing with basic quality joint preps making sure their diet is on cue, which a lot of the area that we preach about the quality of your diet, how that helps to preserve joint structure and joint function. And then you have to feed. I know that sounds odd, but you have to feed that joint space as well. I have tons of literature on glucosamine and chondroitin preps. For example, Grifoni and Lissoni in Italy at La Sapienza University back in the late 90s did a dynamite, about 18-page dissertation on just chondroitin. And I'll get into that in just a moment. But on quality forms of chondroitin and how chondroitin sulfate, low molecular weight forms, Maryland University through the CACO2 trials documented that only certain forms of chondroitin are even absorbed. Some forms are not fully absorbed. Most chondroitin is not absorbed all that well anyway. Even purified forms are poorly absorbed, let alone bad forms, which are absorbed in the single-digit percentages. So prevention, being proactive, the role that your diet plays, your diet absolutely affects your joint spaces. Inflammatory processes, which is many times a manifestation of either sickness, inflammatory diseases, very poor diet. I eat all processed refined foods. I'm very active. I'm athletic. My destruction of joints is outpacing my ability to repair those joints. So what do I do? So now when I say to you that I have oodles of literature and information that is all documented, it's Buffoni and Tilly, by the way, at La Sapienza University in Italy. Tons of good information that document that you can, first of all, slow down the rate of degradation of the joint. You can preserve that joint space. Now, unless you have an immune or autoimmune or you have tremendous damage to that joint through trauma, which may be beyond nutrients, you need to understand, and I'll use the word again, feed, the importance of feeding that joint. Well, how do I feed the joint? It starts with a quality diet. Secondly, I must hydrate, drink plenty of fluids, not sodas, etc. Number 3, you've got to have quality nutrients on board, specifically the glucosamine chondroitin version. Then what about even just simple old-fashioned omega-3s, quality omega-3s, and even the buffered C ascorbates? Why? Because buffered C is also a precursor to this GAG complex. The ability to make collagen, vitamin C, whether it's ascorbate or not, but the ascorbates are going to be used, the buffered forms, to a much greater degree, stay in your system longer. The L-ascorbate forms of C will help you make more collagen structure and more collagen network. So, if I can reduce the inflammatory process, my diet, I eat more of a whole foods diet. I am protecting my joints. You're being proactive 30s and 40s. You move through the 50s, 60s, 70s, you have joint issues. You must begin to feed with specific nutrients. Now that might be something like a joint essentials. Now why a joint essentials? Why omega-3s? Why C? Now this takes you to another level beyond what I drink, what I eat, attempting to protect those joint spaces. Know that you can maintain that joint space. Why? Because these specific nutrients, quality forms of chondroitin that is in a low molecular weight form that absorbs and is in a highly purified form, glucosamine sulfate that is fully reacted. Now what do I mean by that? Do you know that most manufacturers, their glucosamine products are 70% and less pure, if you will? Because what they do is they take, in some cases, glucosamine sulfate, they add potassium sulfate, they literally mix the powders together, encapsulate or tabulate it, and they send it to you, John Q. Public. You read that label and it says, you know, whatever, glucosamine, sulfate, etc. That really is nothing more than glucosamine, in many cases hydrochloride, with potassium sulfate in a powdered form mixed together. That does not mean it's been fully reacted in a laboratory setting. Fully reacted forms of glucosamine, 97+% pure, are reacted in a lab. You have glucosamine hydrochloride reacted with potassium sulfate, Literally, they switch places. You have glucosamine sulfate attached to potassium chloride. Now, that is a fully reacted 97% pure form of glucosamine. So what does that mean to you, John Q. Public, as the consumer? That means that when you use that prep, you will maximize literally almost 100% absorption of that glucosamine. It's highly purified in the right forms that your body can use. What am I doing with that? Feeding the joint. So I use omegas to reduce inflammation. I use buffered C ascorbates to also feed these GAG layers, or this glycosaminoglycans that lead to proteoglycans that lead to collagen in my joint. And now I am beginning a process of maintenance, long-term preservation. Let me talk about dosing. In some cases, we usually recommend 1,500 milligrams, and that's what most of the literature says. There's a lot of controversy in the literature, and some of the articles of which I do have right here, that are contradictory about the role of glucosamine, about the role of chondroitin in their ability to help joint space. If you look at the majority of them on balance, and the ones that legitimately were measuring the amount of joint narrowing, joint space narrowing, and not just subjective, but more of a clinical response, you find that the majority of the studies are far and away positive towards glucosamine chondroitin preps. But why I say to you that you don't just feed with those components, that you've got to do the whole body approach. What you eat, what you drink, reduce your sugar, make sure that you're using omegas to reduce the inflammatory process. Use buffered C ascorbates to help improve repair mechanisms. That's your way to preserve joint structure and joint spaces. Chondroitin in a low molecular weight form that you can absorb. Glucosamine sulfate, literally, that's been fully reacted, 97+% pure, that's not available in many products right now. Unfortunately, much of the glucosamine is brought in from the Orient today, and the qualities of these products are hugely in question. And that is frustrating because in many of the studies where the results were somewhat equivocal, where we didn't see, quote unquote, this huge response from these preparations, many of the times it's rooted in a lack of understanding of what constitutes a quality absorbable product that you can use. If you have joint issues or osteoarthritis, whether it's in your shoulders, whether it's in your knees, whether it's in your hips, you owe it yourself to be on a regime that accounts for everything from your diet, what you consume, what are the cofactor nutrients, omegas and ascorbates, and then preps that contain not only quality forms of glucosamine and chondroitin, but then adjunct nutrients. Boswellia, a natural anti-inflammatory. Curcumin, standardized extracts, an anti-inflammatory. MSM, Opti-MSM, a purified form of MSM. In other words, and some of the other nutrients, the manganese and the coppers and so on, that go along with making cartilage, like glycosaminoglycans and so on, the collagen matrix. So when you see it as a, not just my knee or my hip is where the problem is, and certainly a surgeon will be more than willing to take care of that for you, and thank God for their abilities to do what they can do. But many of you know that if you can avoid major surgical procedures, it's certainly in your best interest. And I'm not saying that this can avert, a knee replacement in every case, but we absolutely have on file records and patients that we have worked with over the course of years that have been able to avert procedures for years and years and years. I think it is in your best interest to understand the dynamics of joint rebuilding, joint maintenance, quality forms of joint building preps, along with those other, now I call them cofactors, such as omegas, buffered C, and then the micronutrients that are in there as well. How do you spell joint relief? I hope you've enjoyed, and I hope you've learned something about maintaining, preserving, protecting your joints. Thanks for tuning in.